quite awake yet.
Good to go.
Should we get started?
Let's do this.
Well, good morning, everyone. Thanks for joining us. We're excited that you're taking part in Sandy's challenge and also just, attending some of these events to learn, new things about health and wellness. My name's Travis Bockenstedt, and I'm with Pinnacle Advanced Primary Care. We'll talk more about our practice sort of later in the presentation, but from a high level, we are a membership-based practice. So I like to tell people, think of us like the Netflix of healthcare or like a gym membership. So you pay a subscription to be part of our practice. So I'm the Chief Experience Officer here, and I deal with our business development. And I'll let Sherry introduce herself.
Hey everyone, I'm Sherry. I am the Director of Member Engagement here at Pinnacle. Some of you may have seen me at a couple of events. I have also joined the challenge. Personally, I have kind of just been in a slump with my weight loss. I was in a car accident in October and just finished physical therapy, and I just needed something to jumpstart me with my fitness and my nutrition. And Sandy's challenge was extremely timeful, and it is definitely helping me get the jumpstart that I need. So welcome my fellow 12-week challengers.
We're going to talk about a few things today. When Sandy asked what type of topic do we want to touch on, one thing I really am passionate about, and we're passionate about here at the clinic, is what we call health confidence. I think a good way maybe to kind of set the stage for the conversation a little bit would be for me to share my personal health confidence story. And if you see Sherry jumping in and out here, we're tag teaming in the clinic today. So I'll kind of get started with my health confidence story. So for all my life, really, I've struggled with anxiety and depression, and like a lot of other people do. And it has definitely had a major impact on my life. It's impacted everything from my personal relationships to my work-life balance. And really about 5 years ago is when things I would say hit the tipping point for me. The day after my 30th birthday, I ended up having a massive anxiety attack that sent me to St. Joe's Hospital in Denver. And I had no idea that I was having a massive anxiety attack at the time, but it felt like a heart attack. My extremities went numb. I went pale. It was one of the scariest things that I have ever been through. And I think what really led up to that was the fact that I had been ignoring it. I hadn't been getting the care that I needed. Basically, I think I was experiencing the healthcare system, unfortunately, like a lot of people experience it. With my anxiety and depression, I really needed a primary care doctor and a therapist that could really take the time to help me figure out what was going on. So instead of, getting better with my mental health, every time I went to, a therapy visit or a psychiatrist visit, they would just, prescribe me medication. And really, I had no idea what, the medication was doing. I think so many of us go in and are diagnosed with a chronic illness, and they just tell us that and just kind of leave us. What do I do with this information? How do I get help? So after ending up in the ER at St. Joe's, I got a $20,000 medical bill following that visit. And I had great insurance at that time, and basically was just getting surprise medical bills out of nowhere, which made my mental health situation even worse because I was staring down, a $20,000 medical bill. So I knew a few things had to change. I knew first and foremost, I needed to change my relationship with the healthcare system. And I didn't even know where to begin because we're so used to experiencing the healthcare system through insurance. Insurance is our ticket to go see the doctor. Insurance is our ticket to go to specialist. Insurance is there if we have a catastrophic issue. But what insurance doesn't guarantee anyone is access to your physician and the time that you need with your physician to actually figure out what's going on. For me, those 5 to 10 minute office visits were not getting me any further at all. So I knew that I need to, like I said, strengthen my relationship with my doctor and become more health confident. So I started Googling doctors who don't accept insurance because I knew the insurance industry was sort of my barrier. And I wanted to find some sort of system where they weren't just churning people through the door every day and they actually had one-on-one time with their provider. So I ended up finding this movement called direct primary care. Like I talked about at the beginning of the presentation, direct primary care is a membership-based healthcare model that really removes all of the barriers of entry to healthcare, removes long wait times, 5-minute visits, all these things that make healthcare a horrible experience. So I had my first visit in a direct primary care clinic in Denver. And my first visit with my doctor was almost 2 hours long. And it was a life-changing doctor's visit. I don't think many people can go into a doctor's visit and say, I came out and my life was changed. But within that 2-hour visit, my doctor had a chance to sort of see me more than just someone with an illness. We had a chance to really look at my entire life holistically, talk about healthcare goals, and really talk about how I personally could manage my anxiety and depression better. What happened over the next few years was pretty transformative for me. After a few visits with my primary care doctor in the direct primary care setting, I started to become more confident in managing my own healthcare condition. What did that mean? That means no more ER visits. So in 5 years, I've not been back to the ER because now I know what an anxiety attack is. I know the signs and symptoms. I know what can cause it. And I know now techniques I can use to calm myself down so that anxiety attack becomes more manageable. That is like priceless to me, because one of the scariest things is when you feel like you have no control over what's going on. And it can even be more scary in the US healthcare system because there are so many unknowns that can come without being confident about your condition. The other cool thing that happened was I was able to do some cognitive behavioral therapy with a therapist, along with having that extra time with my primary care doctor. And we were able to make some transformative changes that not only had, a short-term impact, but really over the past, 3 years have had a huge impact on my life. So health confidence is something that I wish we had more of in the healthcare system. Another thing with health confidence that I learned was how the finances of the healthcare system works. Because we use insurance, I mean, all of you have felt this before, where you go in, you try to ask for a price so you can make a good financial decision about the treatment or specialty care or, procedure that they want to do. But a lot of times we get this answer where it's like, well, it depends on your copay, depends if it's in or out of network, all these millions of factors that you have no control in. So by joining a DPC practice and becoming more health confident, I also learned how to shop for my healthcare, which was huge. And I'm telling you, there's this entire group of healthcare professionals rising up in the Colorado Springs area that are allowing patients to go direct with their care, pay them cash for care so they can get that one-on-one divided attention that they need. I think health confidence is something that I wish we could just teach people and how important it is, but it's certainly transformed my life. And one of the things that working with Sandy and doing this challenge is that she's giving you the tools, the connections, the education to actually become more health confident in helping you reach your healthcare goals. So you guys are already making a really important first step in becoming more health confident and reaching your goals, which I think is really great. Aside from my personal story, I want to talk a little bit about how health confidence in our model impacts people beyond me. Sherry next to me here has way more healthcare experience than I have, but she's also had the opportunity to experience fee-for-service model of healthcare and the direct primary care model of healthcare. And I thought maybe Sherry, if it's okay, and by the way, the folks listening, you're welcome to, chime in via the chat if you have a question. Don't be afraid to unmute your mic and sort of interrupt if you want to interject a question, if it's something that's burning and you want to talk about right now. But Sherry, I want to reflect just a little bit on health confidence and how you've seen the DPC model. What have you seen in terms of patients? We talk about cruising altitude a little bit. So can you tell people who are watching what it looks like when we get a patient in the door, their first day here, and how you see them grow over the next few months with us?
It is completely different. I have been in the medical field since 2008. I've worked traditional medicine most of that time. I worked at the community health center most of that time, and I loved what I was able to do there. I loved Peak Vista and what they do for the low income community and trying to get people access that normally wouldn't have access. But I found myself becoming extremely, extremely frustrated with the system in general. Doctors' offices have to work around the system because it's insurance driven. And it's almost to the point where the insurance company, dictated by ICD-10 codes, which is the diagnosis codes that are used to bill your visit, so that the doctor, the medical assistant, the biller, so that everyone can get paid, so that your doctor's office can continue to stay into business, is basically dictating how the doctor treats you. For me, that was very frustrating. I got very frustrated trying to get patients their medications that they need, and having insurance companies tell me, well, they have to try these 3 before we'll pay for this one. And I'm like, well, they're going to get sick. This is not going to help. Or sending a patient for an MRI and have the insurance come back and say, well, the patient needs to go for an ultrasound first. I'm like, well, this patient's in pain. We need to get them the MRI so the doctor can get the diagnosis they need to treat the patient properly. The ultrasound is going to tell them nothing. And that creates 2 visits for the patient with 2 copays. So this is kind of the frustration that kind of led me to direct primary care. I mean, I have spent 8 hours on the phone with an insurance company trying to get a medication approved, and this was nothing unusual. So when I found direct primary care, like, I had a exhale moment. It really went back to the old idea of family medicine, where the doctor is really getting to know you and your life and what's going on with your life and everything that's contributing to what's going on. And that one-on-one relationship with the patient and their family and the kids. And a doctor-patient relationship should be transparent, number one. You should be comfortable. And I cannot speak enough about being comfortable with your relationship with the doctor and your care team. Like, you should be confident and comfortable in what's going on, and have an active voice and feel that you're being listened to, and participating equally with your doctor in your care. This is your life, your body. So direct primary care for me is like a breath of fresh air, working in it, as well as for the patients. I've had patients tell me they've never been this comfortable in a doctor environment. We've had patients tell us they feel like they're walking into a living room and not into a doctor's office, because you're not rushed. I call it the movement. You're being moved into a room and moved out after spending 6 minutes with your doctor after you waited an hour and a half to see him. We do 30 minutes to an hour appointments. We can do phone visits. We can do video visits when appropriate. We try to do everything we can to treat our patients and make it convenient. So we really, really highly stress and believe that one-to-one doctor-patient relationship, and we stand behind it. We live, eat it, and breathe it. And we actually like each other. And you can feel it when you walk in the office. I walked into doctors' offices and I'm like, these people do not like each other. And it affects your treatment of care. And we actually like each other, and we all get along, and we even hang out outside of work sometimes. So for me, it really is, I love what I do. I was almost frustrated to the point where I almost got out of healthcare. And it has brought me back 110 full. And I love treating the patients. And I think the best thing for me is when you have a patient who has been struggling with someone and not being listened to, and is extremely frustrated, and they walk in and within an hour, you have completely changed their perspective on healthcare, and are getting them the help that they need. For me, that's worth my day every single day.
This might be, if you all feel comfortable who are listening right now live, just like to pose a question to everyone. If you want to throw it into the chat, a yes or no. But at this point in your life, if someone were to say to you, do you feel confident in the relationship that you have with the healthcare system right now? So kind of a question to put into the chat, yes or no. Yes, I feel confident with the healthcare system. I know how to navigate it. I know how to price shop. Or no, I do not feel confident currently in the healthcare system. And if you don't feel comfortable, I totally get it. It is a bit of a personal question to throw in there, but we all got into this direct primary care space really because we wanted to spend more time with patients, which is sort of contradictory to what we're hearing in the current system. We have patients here who have suffered with similar things that I've suffered with the anxiety and depression side, where they were hitting the ER once a week, and we got them in here into clinic where they finally got a one-on-one relationship with a doctor, where they could text them after hours and say, hey, I'm having that feeling again. I'm having that anxiety attack. And just to have a physician text you back and go, you know what? It's okay. Let's talk about some of the coping mechanisms that we've worked on. That's huge. Not only does it give someone else the confidence that they're not going to end up in the ER again, because that's the worst place to be, but there is a huge financial part to the healthcare system that we don't like to talk about. And saving someone $4,000, $5,000, $6,000 on not having to go to the ER can be a pretty life-changing moment for them. Another question I might pose into the chat, and thank you. These are similar things that we hear all the time. People don't have time for me because the schedule's tight, or you feel like a number rather than a patient. This is just part of the system, unfortunately, that is not a good thing to keep people healthy. Primary care is really the foundation of our healthcare system at the end of the day. You're not getting a referral, you're not getting a prescription medication. It really all centers around primary care. Sherry was talking about a little bit about fee-for-service. Fee-for-service, if you guys don't know this, is really that transactional relationship you have with your insurance card and your doctor. Everything you go into that office for has a code. And how many of you have been to a doctor's visit where you come in with one ailment and they're like, great, that's fine, but don't tell me about the next one because we have to schedule another visit to do that, right? And healthcare just doesn't happen that way all the time. So to be able to go, oh, sorry, Sandy.
Oh, that's okay. I was just going to say, I just had a conversation with one of my clients who has a great relationship with Pinnacle and Dr. Lynch, and was saying exactly that this morning, that you go in and you start discussing things and they'll treat the one thing that you called in for. But if you have 3 other things that are related to that, oh, that's a different code. We have to schedule a different appointment. And I just wanted to also address the comments in there with having time with your physician. They feel like a number rather than a person, or they don't have time. You feel so rushed that we forget that they are serving us. We're paying them to provide a service. If I made my clients feel bad for taking my time when they're paying me for it,
Right.
I would be out of business real quick. But why is it that when a doctor actually sits down and has a conversation with us and listens to us without interrupting us so we can explain everything, and they actually take the time to educate us and help us understand what's going on in our bodies that we may not know or we may have a misconception about, that we feel guilty for taking their time. But I'm paying you for that time. I shouldn't feel guilty for taking it. And it's unfortunate that so many of the comments kind of reflect that.
Yeah.
Can I interject something?
Yeah, please.
All right. So my perspective is somewhat interesting, probably. I've been in healthcare for 22 years. Okay. I currently work as a provider, as a nurse practitioner.
Okay.
I do work in rural health, so I can confidently say that I have a great relationship with my patients, and we have 30 to 60, sometimes even 90-minute visits. So I'm very blessed for that. That's why I continue to work in this area of healthcare. That being said, though, I completely agree with a lot, or if not most of what you are saying. In the city, you're cattled through, you're treated as a number, and everything is insurance based. You're absolutely right. My nurses spend hours every day trying to get things covered, like if I prescribe something, and then we have to fight with the insurance companies. So just know that there are providers out there that really are frustrated with the overall way our healthcare system is being ran, so for sure.
And Carrie is an amazing, amazing woman. And it's unfortunate that the physicians, I feel, are also a victim of our healthcare system because they want to provide that care, but their hands are kind of tied. Is that maybe something you see as well?
Absolutely. Absolutely. So you're right. And everyone laughs about my commute because I drive over an hour, but I choose to do this. And certainly it isn't the money, because I make way less money out in rural health than I would in the city.
Right.
But that's not always what it's about, is being able to provide the care that I would want provided to me as much as I can, without the insurance craziness,
Isn't it cool, Carrie, to see when you have that time with a patient and you get to see them a few times? We have a name for it here at the clinic that we call getting people to cruising altitude. So they may come in and you may see them a few times in a row, but it's so cool to get that patient to a point when they finally feel like they're at a cruising point with their condition. And that can only be done if you have time with the patient, I feel like.
Oh, absolutely. And I've had many patients tell me when they've come in to establish with our practice and tell me, I can't believe that you even asked that. No one's ever asked me that before. Or, I never thought to try this because it was never presented or whatnot. So absolutely. And you get way better compliance and, with their healthcare, they're overall taking accountability for their healthcare. They feel like they're being heard and validated.
Well, that definitely speaks to how comfortable your patients are with you, Carrie, and that has a lot to do with it. A lot of us just aren't necessarily comfortable with our doctor, or maybe we're comfortable with the doctor, but not necessarily the care team, or maybe we're just not really comfortable with any of it. When you're comfortable, I feel like participation and compliance goes up tenfold. And that health confidence does begin, and they can begin to understand what is going on with them and their body and how their body works and how it reacts to certain things. And that is very important. I feel like with the insurance dilemma that we're in now, we take better care of our cars than we do ourselves. Yeah. We're making sure we get our oil changed and our alignment and our tires, and the car gets washed to get that salt from underneath the undercarriage. And how often do we invest back into ourselves, especially as mothers? I know with me, like, you often put yourselves last. And again, like Travis said, joining this 12-week challenge is a step in that direction. And we have to keep moving forward in that movement and make sure that we're taking care of ourselves so that we can take care of everyone else.
I think one thing too, we have to start telling ourselves is to stop accepting a mediocre experience in the healthcare system. We've been unfortunately conditioned for decades that this is the best you'll get. And unfortunately, for the majority of the system, it is that way. But, you find rare opportunities and clinics like what Carrie must work for that has that extra time for patients. There's an entire movement in this community, like I said earlier, of direct cash pay providers. The physical therapy community is really grasped onto this, because I think they would say it's really hard to make a physical therapy patient health confident when the insurance company cuts them off after they get a certain range of mobility and they say, you've reached that point, you're done. Or I talk to PTs and they're like, I get 15 minutes with the patient and then I send them off to an assistant to do the rest of the work. And they were frustrated. Their hands were tied because they felt like they were really not moving the needle, with their patients. So it's just something I really wish we could promote more in the healthcare system, is to really ask people, what is it going to take you to be health confident with your condition? Because it does save money. It does save money for the healthcare system as a whole. It also, if we want to get down to it even more, it saves money for businesses. A lot of people, I'm sure, doing the 12-week challenge, maybe you're a solopreneur, maybe you own a small business or a larger business, but the cost of healthcare is really, really expensive. And sick employees and employees who have chronic conditions they can never really get control of end up adding more cost, to the business at the end of the day. So, this is something we need to work on both personally, but something that we need to work on, system-wide. Another question I'll just kind of throw out to the group if you feel like answering in there. What is one thing that would make you more health confident today? So more time with your doctor, better understanding of your chronic illness, being able to get in quicker. Is there anything today as you're thinking about, boy, this would make me more health confident today if I just had this, or if I was empowered with this? So if you have any thought on that and kind of want to throw it in the chat, I think that would be great.
I just
Alicia,
wanted to do real quick, if you don't mind. When you're talking about health confidence, and your story was really powerful with that, I think just education. A lot of people have heard the terms a lot: diabetes, anxiety, pain management, chronic pain, baby checkups. But a lot of, because there's not the time with the physician to really get heard and to get an education, you just kind of get these little snippets, but we don't know what we don't know. And, you felt like you were having a heart attack. That's very real.
Yeah.
But now that you know what those symptoms are, and someone took the time to sit you down and explain that these are physiological symptoms of something that's happening from your brain, and you can learn to control that. Same thing with diabetes. Well, sometimes there's a lot. I mean, it can be overwhelming and people are just like, forget it. I don't want to take the time to figure out the information on my own. And then where do I even start to get that information? One, that's sound, and two, that's going to get me in the right direction. That's not going to be some fad or some dangerous thing. One of my clients actually had a physician. He was in the diabetic realm, and his physician told him, just do keto. That was his solution to helping him with his diabetes. And otherwise, and if you don't lose weight in 90 days, we're going to put you on a medication. Almost a threat. Instead of let's help you learn how to manage your nutrition. Let's help you get into a manageable weight realm. Just that education and that care, that concern and that care. And I think that what you've addressed with the direct care, the primary care, that puts people in the driver's seat. And like you said, you feel more confident in managing your conditions or the issues that you have with your body or things going on. And even like new moms, it's not necessarily a condition, but being a parent for the first time is terrifying. And a lot of moms feel guilty and shamed for taking their child in all the time because they don't understand what's going on. This is a new human being and they don't know what to do. But to have a physician that is going to take the time to make them feel normal, to make them feel like this is normal, your child is great, you're doing a great job, that can be huge in in the next few months of that person's life.
It can be, absolutely can be. And, one thing that we do in the healthcare system, because we can't get that care that we need, is we end up overutilizing it at the end of the day because we're not getting anywhere. Either the goalpost doesn't move or the goalpost keeps moving on someone because their illness is like getting worse as they're trying to get help, to fix it. And I think a lot of people end up just giving up, right? They're like, well, I'll deal with this until I end up in the ER and something needs to happen. Just, for all of you out there that are listening and watching this too, we're not the only direct primary care practice in town. There are other direct primary care practices here along the Front Range and in Colorado. Every direct primary care clinic, I think we found, has their own sort of twist to what they're doing. We are a more traditional full scope family practice here that you would expect from a primary care family practice. There are some practices in town that deal more towards women's health. There are some practices that are more of like a medical spa, and they do other things there outside the scope of primary care. But, for those of you who just commented, wishing doctors knew more about nutrition, or, emergencies that are, multi-day waits. If you really want to change your relationship with the healthcare system, even if you have great insurance, keep in mind, I had great insurance when I ended up at St. Joe's with that massive bill. After I got my direct primary care membership and I still had insurance through my employer, I still paid for my DPC membership out of pocket because I never wanted to go back into a system that didn't give me the time and information I needed to make a healthcare decision. There have been times when my cash pay rate and plan is much cheaper than if I would have ran it through my insurance. And just quite honestly, I don't want the anxiety of dealing with the system at the end of the day.
And I have to think, first of all, I want to thank everyone I'm looking at these comments, and I want to thank everyone for sharing these stories. And I can just imagine the feelings that you got as things were happening. And these are some of the things, unfortunately, that we hear every single day. I was kind of surprised. We have TRICARE patients on our roster. They are just tired of not being able to get access. And here, again, you can have that one-on-one relationship. You have the ability to text, call, same day, next day visits. And as Travis was saying, there's a lot of direct primary care practices in town, and we are friendly with some of them, and we cross-referred if it's not a good fit. And we personally know this physician over here, and this is her specialty, and this is your need. We have cross-referred to each other. Like, we really believe in good quality healthcare, and we want to improve the health of our community in Colorado Springs. It's not just about Pinnacle. And I do want to throw out there, just because of some of the comments I am seeing, direct primary care is a new concept. It can kind of be hard to wrap your head around because we're so used to insurance. If you have questions after this or want to speak one-on-one, you can call me here at the clinic. I'll put my email address in the chat. You can email me if you prefer to do that. And if you even feel like, okay, well, I'm thinking about direct primary care, but I don't think Pinnacle would be a good fit. I'm kind of needing some specialty women's care. I can refer you. If you are struggling with something in your healthcare right now, and you need a change and you're looking for some options, call me.
You might be asking yourself too, what does this cost me to be a member of a practice? So the membership fees in town do range. I would say, so ours for an individual adult is $68 a month to join the practice. If you're a small business owner, it's $65 a month. And then our family rate caps at $180. That's 2 adults, 2 children or more at a flat rate. The other membership fees you'll find in town will be very similar to this. They're going to start around the $65, go up to the $90 range per month. but most members who sign up will continue to keep their DPC membership because it travels with you. So if you end up, leaving a job, you don't have to worry about losing your primary care doctor. How many of us have stayed in a horrible job because of our benefits and the fact that we don't want to lose a physician that's in network? Well, the cool thing with a membership like this is it really doesn't matter. As long as you're signed up and an active member, your work status doesn't matter, any of that stuff. So just something really to consider. If all of you are on this journey with Sandy right now, over the next 12 weeks, I'd encourage all of you to think, what does my relationship with my health and wellness in the healthcare system look like after my 12 weeks with Sandy? What do I want to change? What is it going to take you to become more health confident? Maybe it's not a relationship with the DPC practice. I get it. Maybe that's not your thing. But I would encourage you to start looking and saying, okay, if I need to see a specialist, I want to know some prices, that cash pay rate for that specialist. Is it cheaper? It may be. That specialist may say, hey, it's $1,500 to do the consult and the specialty work with you, cash pay. You might be able to go to your insurance company and they might say, hey, none of this is covered. You're going to be paying $2,500 out of pocket. Well, this puts you, like Sandy said, I think putting you in the driver's seat is a great analogy for the health confidence, because you're in the driver's seat, then your navigation system is like your care team, right? It's your doctor and care team at the clinic that are saying, okay, you've got 3 roads, you can go down here. Here's your options for each path you might take. Having that knowledge when you're in the driving seat, I think is even more powerful for you to have health confidence. I know we have just, about 15, 20 minutes left, and we've talked quite a bit. Are there any questions that all of you want to shout out, either about health confidence, you want to share your own story, you have a story of, you have a question about direct primary care, anything, if you have any, questions that you want to toss out to us.
So I have my friend Jenny with me.
Hi.
Hi. I wanted to share a little bit, but first, I want to say thank you for thinking of such a concept. I'm going through my own journey right now. I just retired in 2019 from 24 years of military service. So the healthcare system I'm used to is the military medical service, which is completely free. So that old phrase, you get what you pay for, is absolutely true. I have recently gone with a functional medicine provider for some healthcare issues that I'm going through. I don't mind sharing all of my problems, but you don't have enough time in this podcast right now. So, but to start with, my primary issue is my thyroid. So I've struggled with that for a few years. And what I find is the VA care, which I still go through because I've earned it and it's free. But what I find the difference is they just, here's a pill for your problem. And with the thyroid in particular, it affects so many other systems. It affects the whole body, right? So what they don't do is they don't communicate with the gastrologist. They don't communicate with a new dietitian or a nutritionist. They're just like, okay, this is the end all be all, take this thyroid medication and that's all we can do for you. And I'm left to my own sources to go to those other entities and figure it out for myself. What has been frustrating on my path is that they don't talk to each other. And I'm having to do all of that work for myself, which is fine. It's about me. But when you have a health condition that also affects the brain and your cognitive, so with my condition, it presented most of the time with huge amount of brain fog. So it was difficult to think for just a daily task. And I don't know, I found a functional health holistic provider that is getting me on the path, and I'm fixing a lot of my problems with simply nutrition. Now I'm still taking the medication because the nutrition can't fix it all. But what I like about what you guys are doing is it seems like you have a team and you're talking to each other, and that's huge, huge.
And we are highly into, as you said, coordinating with specialists and what's going on, because the referral comes from the primary care doctor for you to go to the specialist. And then either the specialist doesn't communicate, which is a huge part of it. That's a huge breakdown in the system. Is I've even called specialist office and they're like, well, we need a medical release. And I'm like, but we referred the patient to you. What do you mean we need a release? We need to know what happened during the visit. So this is another huge problem, and it's not just you, that everyone is facing in the medical system. They're putting a Band-Aid on the thyroid issue that's going on with the pill and not treating the underlying issues and everything that it affects, so that, okay, can we at some point get off this medication or reduce the dose, or how can we make it so that we're not getting all these other side effects? Because like you said, no one's talking to each other. And that is a huge piece that is missing from traditional medicine. And that is, thank God, something that direct primary care is bringing back into the fold, is that communication piece between doctors. We here at Pinnacle, our providers are even thinking of setting something up with specialists where okay, well, if you make your appointment, if you make the first appointment in the morning, we'll sit on the call with you and listen in to what the specialist has to say to better coordinate care, because there's, a missing piece. And there might be questions that your primary care physician might have in relation to what your specialist is saying. And that way they can get their questions answered. So it really is a breakdown across the medical system. Unfortunately, it's not just you. And I think that is why we have some TRICARE patients, because that coordination of care just wasn't happening and issues just weren't getting addressed. So I am so thankful that you did find someone who is working with you and who is addressing your needs and concerns and helping you. It sounds like you're on the path to getting where you need to go.
I want to get to Maria and Ann's questions here in just a second, but I did want to ask you, before you met your functional medicine doctor, if you were to rate yourself on a scale of 1, no health confidence at all, 10, I can, climb Mount Everest with my confidence, what would you rank your health confidence right now on your journey?
Right now?
Yeah.
I think oh gosh, from 0 to 10, probably 20. Yeah, because awesome. And it's because they are giving me the tools and the information to take care of things and make decisions for myself. Like, they're giving me all the data, all the information, and I'm very analytical. So I'm like, I've asked my VA provider for the statistics, for the reports, the paperwork, and I still don't have that from them. And it's not them, I think, being malicious about it. They're on a time crunch, right? And they forget, they don't, they're there to just pump out the pills, and that's what it feels like. I'm not saying there's not good individuals in the VA healthcare system. There are, but right now, yeah, tenfold. Before, absolutely no confidence.
Awesome.
And I don't want you guys to think that we're bashing traditional medicine, because we're not. I have, like I said, I've worked in medicine since 2008, and I have worked with some awesome providers. I've worked with some awesome providers that are still practicing that I would recommend people to in a heartbeat. And it's not necessarily the provider. Well, I don't even want to say not necessarily. It's not at all really the provider that we're saying. It's just kind of the system and the restrictions that the system has put on them and the boxes that they have to work within. And it is literally a box. There's nothing circular. about this system. It is literally a box. And unfortunately, us as patients are the ones that suffer. We feel like we are just hanging on a cliff by a pinky toenail, and that pinky toenail is about to come off. And I hate to see that. It breaks my heart. And that's kind of why I love to see that there are people such as us and other like-minded people and other physicians like Carrie that are trying to change that.
Want to get to two questions. The first one is, do you have pediatricians and your physician retired in protest? One, if I would love to find out the name of that physician, maybe we can save them and introduce them to this concept. But we are a family practice, so we do take care of kiddos. We like to see them
Cradle
here.
to grave.
Yep, cradle to grave medicine is what we do here. So yes, absolutely. It actually, I feel like we save families with kiddos quite a bit of money. We had a family the other day, their 1-year-old did something to its foot and they were considering going to the ER. Well, our doctors had them come in the morning and they used cardboard and tape to create.
She broke her leg.
She broke her leg?
She broke her leg in 2 places.
Oh,
Can
geez.
you imagine your 1-year-old with a broken leg?
Jeez.
And imagine having to wait 2 days to get into the doctor to see what's wrong with your 1-year-old's foot because she won't put any weight on it.
Yeah.
So she broke her leg and we were able to kind of do a makeshift cast for
That's
her.
awesome.
Yeah. So we saved them hundreds of dollars.
Speaking of broken things, the question we get all the time is, what do you do for catastrophic coverage when you're in a membership-based practice like ours? So we, any direct primary care practice should be able to take care of 80 to 90% of all your everyday medical needs. We have an on-site lab, pharmacy, we can do procedures in-house. But then what happens if you get hit by a bus? You get cancer, things like that.
Get in a car accident.
Get in a car accident, yeah. There are two really options out there. One, having direct primary care does allow people to move to a higher deductible health plan. Why? Because if you have an $8,000 deductible, because we have the time, can make sure that you get the most out of that $8,000 deductible, right? So we can help you shop around. If you're needing an X-ray and they're going to charge you $500, we might be able to find you one for
About $100.
about $100, right? So you
$50,
can,
100, depending on what we're X-raying.
so that gives you an example, right? So you're able to move to that higher deductible plan. Or for those of you who have heard of health shares, there are Christian health ministries and there are nonprofit health shares. They both work about the same. They are not insurance, but everybody pools their money together into a pot of money essentially. And if I were to break my leg, Sherry's funds from the health share would go to pay for my catastrophic incident. We're both members of a health share called Zion. So, yep.
Yeah.
We're both members with a health share called Zion, zionhealth.org. For me, it's based on your age and some other conditions, but for me, it's $120 a month for my catastrophic coverage with a $2,500 shareable amount, which is their version of a deductible. And then I pay $60 a month for my direct primary care membership. So $180 out the door. I've got my primary care coverage and my catastrophic, which is quite affordable. And their family rates are right around, I think, $400 for an entire family, $400, $500.
And we do have brokers that we work with that will, they'll sit down and talk to you. And I think she spent like 2 hours with me.
Yeah.
Going over different plans and my options and which option would be best for me. And, ask you family situations and financially. So there are a lot of different options out there. We get a discount on our health share because we are enrolled in a direct primary care practice. So the health share knows like, hey, they're 80 to 90% of their needs are going to be taken care of with this primary care practice. So we'll give them a discount. And I'll be transparent, I'm diabetic. And I am very comfortable. I've got other stuff going on too, but I'm very comfortable with my direct primary care plan in my health share.
Nice.
It really worked out well for me. I was paying $189 last year for mediocre insurance. Plus I had co-pays every time I went to the doctor, and I had a deductible. And now I'm spending about the same amount. Well, I actually was able to explore voluntary insurance, like
Oh, nice.
my short-term disability. Do I want to do vision insurance or not? Or, do I want to increase my life insurance? It actually freed me up some money. And I'm still within the $180 bucket with all the voluntary stuff that I added. So it worked out really well.
So I hope you're seeing a theme here. Don't just settle for the traditional system that's out there. It's what you've been conditioned to of what the healthcare system needs to look like. But we're good examples of that you can shop around and build your own health plan. Now, the caveat of this is that you do need to be an active player in your health and wellness. This isn't just to sit back and take any bill that they send me. This is really taking some time to ask some questions, shop around, but having, again, back into the driver's seat, feeling like you have control over what's happening both physically and finance-wise in your healthcare, I think is a completely freeing experience, especially if you're someone who's been socked with a medical bill that was supposed to be covered, right? And you felt like you didn't get anything out of it. So, if there's anything we can hopefully have instilled in the group today, that health confidence, I think, is the number one thing that you need to be thinking about. What is it going to take me to get from the 1 to the 20, right? What is it going to take me to make sure I'm in the driver's seat? And I have healthcare professionals who are acting as my navigation, right? They are giving me options on roads and places I can go to get where I want to go. I put a link to Sherry's email in there. She's on her clinical side and is really great to speak to. If you have a business, so if you're an individual, anyone that wants to sign up for Pinnacle, Sherry's perfect. If you're a business and you want to talk about adding Pinnacle as an employee benefit, reach out to me. I'd love to help that. We tag team together. You'll see us out in the community all the time. Sandy knows how to get a hold of us. I'll also put in another link, dpcfrontier.com. DPC Frontier has a map tool, and it will show you direct primary care clinics across the entire country. So, someone in another state that's having problems. College kids.
Got a kid in college out of state. This is a great option.
Yeah. So that's a really great resource. As you can see here at Pinnacle, we're all about furthering the movement. We're going to be working on some cash for care stuff that's going to be coming out, which is super exciting. So consumers in Colorado Springs can actually shop for cash for care in the community. But yes, use this as a resource. And Sandy, thank you for letting us.
Yeah, thank you guys
this
so
hour
much.
of time.
Appreciate you guys so much. And just everybody in the 12-week challenge, of course, all of our sponsors are all over my website on several different pages. In the weekly newsletters that you receive, Pinnacle is also linked in the newsletter, so you can visit their website. And of course, like Travis and Sherry have both provided their email addresses. So really appreciate you guys. And I know I probably all my clients have heard this, but I talk about the first time I met you and walking into your office, and Sherry, you described that. Sometimes you walk into offices and you're like, you just feel like there's a heaviness across the employees and the doctors and the physicians. And you walked into Pinnacle and it was like a family, it was like having a party. It was like, this is super cool. So you guys are just amazing. And I appreciate your time this morning and answering all the questions and sharing all the awesome things you guys are doing.
Absolutely.
Thank you. Appreciate it. And again, I'd just like to say, like I said, if anyone, I direct primary care, I worked in it for like a month before I fully understood like what it was. I was just like, I just knew this was great. I got time to spend with my patients. I can actually sit down and explain stuff to them. I was like, this is great. So if you do, again, if you have any questions or need any recommendations, or even like if you're looking like for like, I think I need a specialist for this. Do you know of any good ones? Feel free to reach out to me. It's fine. I have a huge referral binder. If I can help you, I'm willing.
Thank you guys. We appreciate it.
We will see you soon.
That's good. Take
Bye.
care. Bye.
Bye, guys.